take place.
The Indian Council for Medical Research issues guidelines for all individuals who have undertaken international travel in the last 14 days but still not showing symptoms. They should stay at home under quarantine for 14 days. Also says they should be tested only if they show symptoms. Prime Minister Narendra Modi holds a meeting with chief ministers of states through video conferencing, calls on states and the centre to work together. Meanwhile, number of confirmed COVID-19 cases rises to 258. In a major announcement to fight coronavirus, no passenger train will originate from any railway station in the country starting midnight tonight till 10 p.m. on Sunday. Mail and express trains will also stop services from 4 a.m. on Sunday. Prime Minister Modi thanks people from different walks of life for supporting the cause of Sunday's Janata Curfew. Influencers and achievers from various fields and several organizations have come out in support of the Janata Curfew. States take major steps to prevent coronavirus spread. Ban on outsider passengers to Leh, Mumbai, Nagpur, Pune and Pimpri-Chinchwad to remain closed in Maharashtra till the 31st of March. Exemption for essential services, banks, grocery stores and medical stores. All malls closed in Delhi till the 31st of March. All markets in Delhi to be closed for the next 3 days. No metro services on Sunday. Section 144 imposed in Haryana. The PM thanks Prime Ministers of Bhutan as well as of Nepal for contributing in the COVID-19 emergency fund. Says it's wonderful to see SAARC leaders taking initiatives that are adding strength to the collective fight against coronavirus. And the coronavirus pandemic continues to spread across the world. More than 2.5 lakh infection cases and the death toll has now gone past the 10,000 mark. Italy has recorded 627 deaths, taking the total toll over the 4,000 mark. France has reported 78 more deaths in 24 hours. UN chief warns that global recession is a near certainty. Namaskar, you're the latest here on DD News and DD India. I'm Gautam Roy. Now, the Indian Council for Medical Research has issued a revised strategy of COVID-19 testing in India. The ICMR, in its revised treatment strategy, has said that all asymptomatic individuals who have undertaken international travel in the last 14 days should stay at home under quarantine for 14 days. They should be tested only if they become symptomatic, that is, if they have fever, cough, difficulty in breathing, etc. All family members living with a confirmed case should be home quarantined as well. The ICMR has also issued the testing strategy for all symptomatic contacts of laboratory confirmed cases, all symptomatic healthcare workers as well, all hospitalized patients with severe acute respiratory illness, asymptomatic direct and high risk contacts of high risk cases should be also tested once between day 5 and day 14 of coming in contact with the symptomatic person. Direct and high risk contact include those who live in the same household with a confirmed case and healthcare workers who examined a confirmed case without adequate protection according to WHO recommendations. Prime Minister Narendra Modi held a video conference on Friday with chief ministers of different states to assess the preparations being made by them in the fight against coronavirus. The central government is making every effort on war footing to overcome the COVID-19 challenge. The risk profiling of passengers has been expanded to include all passengers from Australia, UK as well as the US.
Prime Minister Narendra Modi held a video conference with chief ministers of various states and deliberated on ways to check the spread of the virus. Union Health Minister Dr. Harshvardhan and top health ministry officials were also present in the meeting held via video link. Prime Minister said that the threat of the pandemic is common for all states and underscored the need of centre and all states working together. He said that while participation of citizens is necessary to combat the challenge, panic needs to be avoided. He added that given the global context of the spread of the virus in various countries, constant vigilance is of paramount importance. He said that the next 3 to 4 weeks are crucial in efforts to contain the spread of the virus, and the most important measure for containment is social distancing. He requested the chief ministers to ensure effective implementation of the same. The chief ministers briefed the Prime Minister and others about the preparations done till now. They requested for augmentation of testing facilities, greater support to vulnerable sections, advancement of financial disbursement for 2020-21 to the states, and requested for roping in private labs and hospitals in larger numbers. All the chief ministers assured their support and reaffirmed that all states will work together with the Government of India to combat the pandemic. They thanked the Prime Minister for the support given by the centre and also appreciated the impact of Prime Minister's message in his address to the nation. Prime Minister in turn appreciated the steps taken by states and thanked them for sharing their experiences and giving suggestions. He stressed on the urgent need of capacity building of healthcare workers and augmentation of healthcare infrastructure. He suggested that the chief ministers should do video conference with trade bodies in their states to prevent black marketing and undue price rise. He urged them to use soft power of persuasion as well as legal provisions wherever necessary. Earlier in Lok Sabha, Union Health Minister Dr. Harshvardhan reiterated that there is no community transmission of the virus in the country. All known best practices have been put into action to tackle the challenge.
Infection in this country, you see, it is traveling from one person to other. It has not yet gone into the community. Even for the community also, separately, the ICMR is doing tests for picking up people from the community to see whether there is any evidence of transmission in the communities.
Government is laying maximum emphasis on social distancing. Advisories have been issued to cut down on use of public transport and to maintain distance between passengers while travelling.
एक मुख्य अंश ये भी था सोशल डिस्टेंसिंग के रूप में कि जो हमारे मोस्ट वल्नरेबल, जो हमारे एल्डरली हैं, सीनियर सिटीजन्स हैं और इसी तरह से जो छोटे बच्चे हैं, हमने उनको, माननीय प्रधानमंत्री जी ने भी उनको रिक्वेस्ट की थी, उनको कहा था कि आप कृपया आने वाले कुछ समय तक अपने घर में रहें, जब तक कि आपको कोई मेजर कार्य ना हो, बाहर ना जाएं.
Steps to tackle the COVID-19 challenge are being taken on a war footing. With Bureau Inputs, DD India.
Now, the total number of confirmed cases of COVID-19, including foreign nationals in the country, has risen to 258. Active cases across the country as of now are 231. 22 people have recovered after treatment. 1 migrated, while 4 deaths have been recorded across the country as well. In a major announcement, Indian Railways has said that no passenger train will originate from any railway station in the country from midnight tonight till 10 p.m. on Sunday. Mail and express trains will also stop services from 4 in the morning on Sunday. All suburban train services will be reduced to a bare minimum as well. Passenger train services already on run will be allowed to run to their destinations. The IRCTC has ordered the closure of all on-board catering services in mail or express trains from the 22nd of March until further notice in view of the coronavirus outbreak. IRCTC has also decided to close all food plazas, refreshment rooms, Jan Ahars and cell kitchens until further notice. The static units supplying meals to prepaid trains which are in operation may continue to operate. The on-board catering services in mail express trains and TSV trains should be closed until further advice. Prime Minister Narendra Modi has hailed the efforts of people from various walks of life who have come together to support the initiative of Janata Curfew on Sunday, that is the 22nd of March, in an effort to contain the spread of coronavirus. Influencers and achievers from various fields and several organizations have come out in support of the Janata Curfew and have urged the nation to come together to make it more effective. Maharashtra has the maximum number of positive cases so far amid growing concern over the spread of coronavirus. Chief Minister Uddhav Thackeray has announced that all workplaces in major cities in Maharashtra, including Mumbai and Pune, will remain closed till the 31st of March. The shutdown will be applicable in Mumbai, Mumbai Metropolitan Region, Pune, Pimpri Chinchwad and Nagpur. Essential services will remain open, which include food, milk and medicines. Banks will also remain functional. In the national capital, the Delhi government has decided to discontinue its non-essential services till the 31st of March and allowed workers of such departments to work from home. Orders have been issued under the Epidemic Regulation Act for closure of all shops and shopping malls in Delhi till the 31st of March, except for shops dealing with items of daily needs. The DMRC has announced that in view of the Janata Curfew on Sunday, there will be no metro services on that day. Meanwhile, the Haryana government on Friday asked all deputy magistrates and commissioners of police of the state to invoke Section 144 as a precautionary measure to prevent the spread of COVID-19. Now, 6 fresh cases of the new coronavirus have surfaced in Rajasthan. Among the 6, 5 are staff members of a private hospital where a doctor tested positive for COVID-19 in Bhilwara. Another positive case has come from Jaipur, therefore taking the total number of positive cases to 23 in the state. Out of the 23, 3 patients, including an Italian tourist couple, have recovered. The district administration of Bhilwara has sealed the borders of the city and implemented prohibitory orders under CRPC Section 144 to prevent the spread of the virus. Similar action has been taken in Jhunjhunu, where 3 positive cases were detected. When everyone prefers home isolation to stay safe from coronavirus, these brave Safai Karmcharis of Jaipur Municipal Corporation are braving every day to maintain sanitation and cleanliness. Let's join our hands to applaud them along with the medical and health workers on the appeal of the PM tomorrow. The Uttarakhand government has banned the entry of domestic and foreign tourists into the state until further orders to contain the spread of coronavirus. Uttarakhand is the second state to do so after Sikkim. The Ladakh administration has ordered all commercial flights not to carry outsiders to Leh airport. Secretary and Divisional Commissioner Shaugat Biswas said administration is taking stringent precautionary and preventive measures in view of the outbreak of COVID-19. In an order, inbound passengers other than residents of Ladakh, civilian officers and officers of uniformed forces serving in Ladakh or on duty in the region shall not be carried by the commercial flights to KBR airport in Leh. In Meghalaya, the state government has decided to impose restriction on the movement of public transport and to close all shops, markets and establishments with effect from midnight tonight to midnight of the 21st of March throughout the state. The restriction comes in view to enforce the advisories and restrictions issued by the state government for containment of COVID-19 and to carry out intensive awareness programs on preventive measures to contain the spread of coronavirus. Meanwhile, in view of the prevailing situation concerning COVID-19, the East Khasi Hills Deputy Commissioner has issued an order for promulgation of Section 144 CRPC throughout the district. Arunachal Pradesh government has barred all visitors from entering the state. In an order issued on Friday, the government said that all visitors and tourist inner line permits stand cancelled with immediate effect. Chief Minister Pema Khandu in a tweet said that as a precautionary measure, Arunachal Pradesh has closed its door to all visitors in view of COVID-19 pandemic. He said all inner line permits issued earlier stand cancelled. He said well-being of the people of the state comes first. Meanwhile, singer Kanika Kapoor, who had attended several gatherings in Lucknow and tested positive for coronavirus, has been booked for negligence and disobedience to the order issued by a public servant. In Kerala, 12 more persons have been confirmed with COVID-19. While addressing a media briefing, CM Pinarayi Vijayan told the media that among the new cases, 5 are foreigners, 6 are the natives of Kasaragod district. He said the Kerala government will support the Janata Curfew on Sunday in all possible ways. Meanwhile, severe restrictions have been imposed in Kasaragod district. 1 week holiday has been announced for government offices. All religious institutions will be closed for 2 weeks, while all shops will function between 11 a.m. to 5 p.m. With 12 fresh cases reported, the total number of confirmed COVID-19 cases in the state has reached 37. 44,390 under observation and 225 persons in various hospitals across the state are there as well. Now, Uttar Pradesh Chief Minister Yogi Adityanath has said that the state government has taken several steps to contain COVID-19 outbreaks, such as stopping mass crowding of people, closure of schools and colleges, and social distancing. He was addressing the media in Lucknow.
अब तक कोरोना वायरस से 23 पेशेंट चिन्हित हुए थे। इनमें से 9 पूरी तरह स्वस्थ हो चुके हैं। स्वाभाविक रूप से इससे घबराने की नहीं, बल्कि इन चुनौतियों से जूझने और लड़ने के लिए अपने आप को तैयार करने की आवश्यकता है और इसमें बचाव का पक्ष सबसे बड़ा महत्वपूर्ण है।
Now, Union Health and Family Welfare Minister Dr. Harshvardhan has tweeted urging citizens to break the COVID-19 myths. He said only 2% mortality rate there is in the country due to coronavirus. An infected person can recover completely, as it is highly infectious and only designated labs can test infected people. He's also urged citizens not to panic or indulge in rumor mongering. Prime Minister Modi has appreciated Nepalese Prime Minister KP Sharma Oli's announcement of contribution of 10 crore Nepalese rupees to the COVID-19 emergency fund. In a tweet, the PM said, and I quote, "Deeply appreciate PM KP Sharma Oli's announcement of contribution of NPR 10 crores to the COVID-19 emergency fund. It reflects Oliji's commitment and support to the collective fight of SAARC countries against the pandemic." The Prime Minister has also appreciated Bhutan's Prime Minister Dr. Lote Tshering. In a tweet, the PM said, "Gratitude to PM Bhutan Dr. Lote Tshering for his decision to contribute $100,000 to the COVID-19 emergency fund on behalf of the Bhutanese government. It's wonderful to see SAARC leaders taking initiatives that are adding strength to the collective fight against coronavirus." And the Bhutanese PM has thanked Prime Minister Modi for the appreciation. In a tweet, he said, "The amount may be small, but it is contributed with lots of prayers and affection from all Bhutanese for the larger interest of the people of the region. This noble initiative of Prime Minister Modi will be of huge help to those more needy." Now, amid the ongoing COVID-19 pandemic outbreak, Air India flight will leave in the afternoon for Rome to get back stranded Indians in Italy. The government has taken further preventive measures to achieve social distancing to contain the novel coronavirus outbreak. It has decided to grant commuted leave without production of medical certificate to those officials who are above 50 years of age and have underlying conditions like diabetes, respiratory problems and other life-threatening illnesses for a period till the 4th of April. The decision has been taken to avoid unnecessary burden on the healthcare system. The DOPT in its order said that the officials appointed as consultants and advisors after their retirement who are at the age of 60 years or above may be allowed to work from home with the permission of the head of departments without adversely affecting their consultancy fee till the 4th of April. Besides, the contractual and outsourced staff may also be allowed to attend office on rotational basis without deduction of any wages for their absence from work up till the 4th of April again. University Grants Commission Chairperson Professor D.P. Singh has appealed to the teaching community to come together and spread awareness among the society on the menace of COVID-19. He hoped that the academic fraternity will be together in the fight against COVID-19.
संकट की इस घड़ी में मैं देश के सभी विश्वविद्यालयों के माननीय कुलपतियों, अपने लगभग 40,000 महाविद्यालयों के प्रधानाचार्यों एवं 14 लाख शिक्षकों, गैर शिक्षक साथियों तथा 3 करोड़ 74 लाख विद्यार्थियों से अपील करता हूं कि वे धैर्य बनाए रखें और सभी सावधानियां बरतते हुए अपना बचाव करें। मैं आपसे यह भी अपील करता हूं कि अपने परिवार के सदस्यों, संबंधियों, मित्रों, सहयोगियों और समाज के सभी वर्गों को जागरूक बनाकर उन्हें भी इस वैश्विक महामारी से बचाने में सहायता करें।
And let's now get to some facts about the coronavirus. Well, what are coronaviruses? Coronaviruses are a large family of viruses. They cause diseases ranging from cold to SARS. Coronaviruses are physically larger than other viruses. They have spike projections which resemble a crown. hence the name corona. There are 7 strains of human coronaviruses. 6 strains of coronaviruses were known earlier, including SARS, MERS. 7th strain of coronavirus is now named COVID-19. Coronaviruses cause respiratory infections in humans. They are known to cause a significant percentage of all common colds in humans. Coronavirus spreads through both direct and indirect contact. That's what we can tell you about coronavirus for the moment, and it causes severe and acute respiratory symptom and syndrome as well among humans. Moving on further, if we can get you the next story up, if we talk about what's happening in terms of what the United Nations is saying, well, UN Secretary General Antonio Guterres in a video message called for solidarity, hope and political will to see this crisis triggered by COVID-19 together. He talked of the need for global cooperation in the fight against COVID-19.
We are facing a global health crisis unlike any in the 75-year history of the United Nations. People are suffering, sick and scared. A global recession, perhaps of record dimensions, is a near certainty. This is a moment that demands coordinated, decisive and innovative policy action from the world's leading economies. We must recognize that the poorest countries and most vulnerable, especially women, will be the hardest hit. This is above all a human crisis that calls for solidarity. In managing it, we also have a unique opportunity. Done right, we can steer the recovery towards a more sustainable and inclusive path. I call on all leaders to come together and offer an urgent and coordinated response. And the United Nations will support all governments to ensure that the global economy and the people we serve emerge stronger from this crisis. More than ever before, we need solidarity, hope, and the political will to see this through together.
Now, the World Health Organization has warned that young people are not immune from coronavirus and must avoid socializing and communicating it to older, more vulnerable people. WHO chief's remarks have followed reports that young people in many countries are being complacent about health warnings because of the greater susceptibility of the virus among older patients.
Today, I have a message for young people. You're not invincible. This virus could put you in hospital for weeks or even kill you. Even if you don't get sick, the choices you make about where you go could be the difference between life and death for someone else. I'm grateful that so many young people are spreading the word and not the virus. As I keep saying, solidarity is the key to defeating COVID-19. Solidarity between countries, but also between age groups.
And that's all we have for the moment in this edition of the news. For all the latest, stay tuned to DD News and DD India.